welcome back to season 2 of Sleepless in Dubai. My name's Julie Mallon. I'm a sleep consultant. I'm a midwife and many, many things, but I'm also a mother to 3 amazing human beings. And I will now hand you over to my co-host, Laura.
Yes, my name is Laura Buckwell. I'm an international event MC and broadcast journalist, and most importantly, a mother of 2. And yes, we are here at the incredible Baby Expo here in Dubai, and it's a great pleasure to be joined by our guest, Dr. Rafif Tayara, who is a pediatric dentist. She's an author and also a mother of 3. A very warm welcome.
Thank you. Thank you so much for having me. No, you're welcome.
Well, I've just given you a very, very brief introduction. So tell us a little bit more about what you do and how you got into this field as well.
So I'm a pediatric dentist. I'm also a child health expert, and a mom of 3. I have twins, and recently just had a baby, and I just recently published a book that is aiming to raise awareness around oral health for babies and kids. So it was a bit of an anecdote how I got into pediatric dentistry. I got into dentistry because of my mom. My mom has always wanted for me to be a dentist. I think it was like a dream for her, for her daughter to be a dentist. And then I just, I had just high grades in school, and I just, when you're in high school, you don't really know what you want in life. So she registered me into this entrance exam for medical school, and I just got in randomly one day, and I'm like, okay, I don't really know what I want to do. Let's just try this. And then the dentistry days went very, by. I was just, doing what I needed to do, but it wasn't really my passion at that point until I went for an internship in a children's hospital in Montreal, in Canada, and it was one of the biggest children's hospitals in Canada where we had, special kids with special needs coming from all over North America to just fly to that hospital. And I think it was a milestone in my life because I watched a very famous pediatric dentist treating special needs kids on that day. And I was like super inspired. I told myself that day, I was 22. I told myself that day, this is what I want. This is what I want to do. And then from there on, just the journey began into training to become a pediatric dentist, which is an extra specialty, just like, a pediatrician. There's so many things there that you mentioned, and particularly being here at Baby Expo.
Yes.
You talked about almost the power of motherhood. Your mother really led you to what became your passion. So I think that's a really wonderful lead within our story. But certainly having, children who are 13 and a very young baby, so that how do you navigate that role? Because the needs of your 13-year-old twins are very, very different to your 9-month-old. And I think also you as a mother, within those years, you have very much changed as to the mother that you were as opposed to the mother that you are. So give us sort of an insight into that.
Yeah, totally. I always tell my family and friends that, when I had twins, I was just about turning 30, and I was very, you're not really aware of, the motherhood, manual of instructions, right? Motherhood, I think, is one of the lack of the manual. One of the things in life that don't come with a manual. You just learn it on the go. And then with the twins, I feel I learned a lot, but what I was also having twins is having a crash course, of motherhood at the same time, because you don't really have time to learn a lot. You just have to, do it. And I was also a single mom for 10 years with the twins, so I was the only parent available for them. So this experience really shaped me, not only as a mom and as a business person, but also shaped me as a dentist, because I feel as a pediatric dentist and as a pediatric healthcare professional, I feel that I relate more to moms or to parents or to a community because I'm a mom, because of my motherhood. And I don't know if that makes sense, but even when I take my kids to a doctor, I feel that I have more trust if they are also a parent.
It just doesn't make sense, right? Because the things that you go through, that you learn, that you understand, that you can relate to, when you do it as a mother, is very different than when you do it as a, non-parent.
That's incredible that you've had to juggle, being a single mom with twins and a career, really, impressive career at that as well. Let's talk a little bit about, obviously we're here at a podcast, so
yes.
I wanted to get your sort of personal take on how you've managed all of that and how you, have you had to prioritize sleep within, juggling these different areas?
I mean, personally, sleep for me has been, the quality of sleep has been always an issue in my life because, you're juggling too many things, you're sometimes sleep deprived. I was reading a study a few days ago that moms worldwide and statistically wise are sleep deprived chronically. All the studies are actually all the sleep studies are made more on men.
Absolutely.
Than
that
on women.
I find really staggering. So up until the 1950s, 1960s, all the research that we have is only on men.
Why on earth is that?
Of its time. But thankfully now things have changed.
Yes.
But going back to, the sleep and being sleep deprived, I still feel that there are a number of things that we can do. And this is what part of this podcast is about, is that helping parents, individuals, all of us know that even the smallest changes can make the biggest difference. And something so little as strengthening what we know to be our circadian rhythm. The circadian rhythm is basically light. And we know that within the environment in which we are, every one of us are in now, and you being in your dentistry, in the studio, in your clinic, but the light that we are exposed to is 100 times less in the day than we need. And in the night, the light that we're exposed to is 100 times more than the body and the brain needs to cue the brain for sleeping. Now,
so true.
You were saying about your sleep quality. We're also now understanding about sleep quality, and it's not just about duration. But again, what the podcast is also wanting to do is really help parents and all of us to understand we're not to be anxious about it, because when we get anxious, that's going to have a more negative impact on our sleep. Going back to our children, where do you think, and of course there's many, many studies to show us about the role of oral health and sleep with our children. So maybe you'd like to give us some information.
Of course. Yeah, in the last few years, we had 20 years ago, we had a huge gap between the mouth and the brain and the gut and the other organs of the body. There was always this gap, to a point where sometimes even pediatricians, they see a child and they don't look at their mouth. And then in the last years, we've crossed, a path where now we really recognize that the mouth is the gateway of the body. And then there's so many issues even that we detect. For example, we can detect early cancer through the mouth way before it shows on an X-ray or in a blood test.
Wow.
So, and we know now the relationship between having a miscarriage or an early preterm birth with a poor oral health disease. We know now that a blood clot can be initiated with a poor oral health. We know that gum disease now is the 6th most common, epidemiological health problem in the world. And going back to oral health and sleep, it's a huge connection that I'm dealing with every day at the clinic now. As actually, it's now part of my missions at the practice, because I'm part of a big team spread over London and Germany and Netherlands actually to kind of improve this, because we are realizing more and more that kids who are mouth breathing at night, they are on a fight or flight mode. They are oxygen deprived, and they are waking up in the morning with fatigue, with low energy levels, and a lot of ADD or attention deficit issues that are sometimes mislabeled or confused or misdiagnosed are actually related to their mouth breathing. So, within the team that I'm working with, I'm closely every day working with pediatric ENTs to be able, because I'm usually the person who is detecting them the first, because I see a child on my chair, and because I see a lot of kids, I can tell who's mouth breathing, who's exclusively nasal breathing. There are so much impact on the teeth and on the development of jaw, because kids who mouth breathe at night, they also have small jaws. They have crooked teeth. They don't have a right posture of their tongue, because when you sleep, when you have a good, position of sleeping, your tongue should be rested, on the roof of your mouth.
Have you heard of a very famous science journalist called James Nestor?
Mm-hmm.
So James Nestor has written a book called Breathe, and it's talking about how, we were never meant to eat pureed food. Our children weren't meant to eat pureed food. And that's why we are seeing so many problems at the minute. I'm quite certain that if you went into a classroom now of 10-year-olds, that you will see perhaps 70% or 10 and 11-year-olds are requiring or having orthodontic treatment.
Yes, and it's only increasing.
Yeah.
And that's what we're seeing at the clinic every day.
Again, just bringing this back to sleep, and not just about sleep, but the symptoms of sleep apnea and poor mouth formation, oral formation are very, very similar, like you were saying, to ADHD. So lack of concentration, lack of agitation. And so it really is about helping parents be aware,
yes.
Which is why, your book, if I just may, I think it's really wonderful. Anything out there that we can show parents, and it's a really lovely book. So Danny and Sarah go to see Dr. Smile. We want our children to feel comfortable going to the dentist, which means they're going to get the best sleep too.
Yes, and it means also that we detect those issues earlier, and then we tackle them earlier. Because how many adults in your family or friends or surroundings who snores?
Yeah.
How many adults who sleep talk, right? Sleep talking is also one of the signs and symptoms of mouth breathing.
Yeah.
So there are so many, and then a lot of adults don't know that snoring can lead to sleep apnea. You can stop breathing at night. How many adults who have ADD? You see them; they cannot focus on a conversation.
No,
cannot continue a sentence.
My children.
They move from one topic to another.
Right up in bed and everything.
So welcome back, and I would like to ask the question about this wonderful book that you have created. Now, what I find within my practice is parents are very surprised as to when they should bring their child to the dentist. So anything that can get them there as early as possible, then that's exactly what we need to do.
Mm-hmm.
So talk to me a little bit about your book, and it's called Danny and Sarah Go to See Dr. Smile.
Yeah. So this book actually came as I've always wanted to write a book, but this specific book came because in my career as a pediatric dentist, I don't only deal with children, but also with their parents. Because usually in my room there's always this trio: me, the parent, and the child. And what I've always been observing through the years is that most of the phobia, or the fear or the anxiety that the child presents with, most of the time it comes from their parents. It's really most of the time that the adult has dealt with a negative experience at the dentist, has a negative relationship with their teeth, their smile, or their mouth, and they are transferring there to their child. So in all of my career, I've always been, trying to see, okay, how can I deal with this? Do I separate the parent from the child? Of course, when you bump into cultural barriers, especially in Dubai, there are a lot of parents this would be like a no-no or almost like an insult. So this book came a little bit of, out of a production of this, because it's a book that explains very well, in a very friendly and positive way, the actual first trip to the dentist, with very friendly and concrete illustrations. And sometimes, because I've dealt with a lot of kids under the spectrum of autism, for autistic kids, the best way to have them deal with anxiety is to show them photos or pictograms of the actual event that will happen soon. So I found that writing a book about the first, trip to the dentist for a child who has never been, or for a child who has had a negative experience, will, take me a long way. And actually now, this book has been published for the last 2 months, and only in 2 months, I've seen the impact on children who have read it and came to their appointment versus children who have not read it and came. And I'm seeing a huge positive impact.
I also see that as well in my practice, in that I think as parents, we can project so many of our emotions, which we're not aware of at all. And, I'll often say to my parents there's a part of the brain which are called the mirror neurons.
Yes.
And these are activated much more easily than we as parents think. So, for example, if you were offering a piece of broccoli, which you might hate as a parent, and you're saying, this is the most delicious, your child is going to pick up that you don't like it. Yes. Because the mirror neuron within your brain has triggered and projected to your child.
Yes.
And of course, the other thing is that they're very aware of your tone far more than your words. So it's very much about what we are projecting and just being mindful. And I really do often say it is about, fake it until you make it. Yes. To the parents, because we really want our children to feel safe and secure. And only by them knowing that we feel safe will they be able to do so.
Yeah, I read a quote from a famous child psychologist saying that children borrow the mental health of the mom. They borrow.
That's a lot.
So you have to be very careful as a mom, what to lend to your child as, as a mental health, because they really borrow it, and then, that's what they have as an ingredient in their brain to work it through.
I love that comment, but my only feeling about that comment is all the pressure that we put on a mother.
Yes.
That's a huge amount of pressure on her. And I think now it's very much about pressure on the parent.
Yes, and that's also
that we have to say.
Exactly, and that was also the difference for me between being a mom, 12 years ago and being a mom now. Because now, as a mom, because I matured and I'm older, I feel that I'm learning more, what to lend.
Oh, I love celebrating
what to lend.
I love celebrating that.
But it's so true. It's as you're growing, you feel that you're more aware of your surroundings, of what you're saying, what you're not saying. But I think for young moms, it's not easy, right? As you said, there's a lot of pressure, and then motherhood doesn't come with a manual of instructions. So
I know
it's heavy,
It is, and I know Laura's dying to get here. But I just want to say one thing in terms of the neuroscience. Know that the neuroscience, as women age, our role is very, very different.
Yes.
From being a mother to being within our community. So the neuroscience is showing us some wonderful things.
So I wanted to go back to sort of inflammation of the gums and the disease, and there's apparently a huge link between heart disease as well and gum health. And surprising, there's other things that you mentioned earlier. So what do we need to do? Because obviously, inflammation is linked to sleep, right? So how do we combine everything and wrap everything into one, especially when it comes to prioritizing sleep? But what do parents need to do to make sure that their children, are okay?
Yeah, so the main key is going early, and that's also the purpose of this book. As the earlier you expose your child to a pediatric dentist, the earlier you can detect those issues, and the earlier you can solve them. And for us, solving them is not just a one recipe that goes for all. It's really a full scope treatment approach that not only tackles the expansion of the jaws, because in those cases when we have a mouth breather, or for example a child who grinds their teeth, because also grinding teeth for a child is also a symptom of an airway stress problem. So when we see those kids, we work closely with the ENT to, check for big tonsils, adenoids, upper airway obstructions. But what we do jaw expansion. So I expand the jaws of the children as early as 5 and 4. Wow. So I really work. I do my orthodontics or my, we call them braces, but they're not really braces. They are early facial correction. So what we do is I make the jaws bigger because I want to make a space for the tongue to be able to go, up. Because for a lot of kids, because their jaw or their palate is small, their tongue cannot rest. For example, children who's been thumb sucking for a long time or using the pacifier intensely for years, those kids, sometimes their tongue cannot rest on the tongue. And then the main also thing to take away also, I think, from this episode is, it's really about early detection, and it's really about tackling the issue from so many aspects. So one thing also that we look at, just like you mentioned, so interestingly, the diet. Diet is so important, and then sometimes first moms are very scared to give pieces or to get the babies through, but a lot of moms don't know, for example, that fact, but babies can chew without teeth.
Oh, I told them about how
they can chew mainly on their gums.
Yeah.
So this is something, for example, now that it changed me as a mom compared to 12 years ago with my baby. Yeah. She eats, chewed food since she was like 5 months.
It was changing all the time. That's the thing.
Exactly.
Now until then.
Because chewing, and actually in London, there's a very famous doctor. His name is Dr. Mew. He was on Netflix recently, where he is talking about the mewing effect, which is the importance of chewing for a child. And we know that in today's world, children, they moved from the primitive raw food to soft food, nuggets, pasta, rice, crackers.
And do you know which it was in England where the kids' menu was created. Children don't need a different menu. Children need to eat what we're eating.
Yes.
And then the other thing that I explain, often to parents is that chewing the food is going to increase their microbiome, so giving a healthy gut. Chewing the food is going to help with their speech and language, and chewing the food is going to help with their jaw formation.
Yes.
Sadly, we have run out of time, but last question for you, though. For you personally, what is your ideal sleep routine to give you the best night's sleep?
So for me as an adult, it's something that I researched personally over the years, but I find having a walk, on a daily basis, and this, joins your idea of, getting the rhythm. I find it essential for my mental health. So it just, even for a few minutes walk a day, it really helps. One, that regulates, my sleep routine. Another thing is what we call a sinus wash. So sinus washes are super important as a routine also for kids. And this is something I implemented also for my kids. It's a special sinus wash that comes in a bottle and special saline water that you kind of, wash the whole nose. So it's a little bit like, going to the toilet, but for your nose. And that helps like massively with encouraging nasal breathing rather than mouth breathing, and then having the baby or the child seal their lips.
And I think here
it improves massively the quality of sleep.
Where we have so much AC here, I think that may be so fun.
Yes, and the rate of asthma and allergies that I see here with kids is almost 8 out of 10. Yeah, because of the whole cleaning your air ducts, for example.
My kids are always getting bronchitis. It's always like a chest infection.
Yes.
It always progresses.
Yes,
It's very frustrating.
And mouth breathing also increases the risk of having ear infections. So you see those kids getting colds and viruses all year long.
Yeah.
And this is a red flag. Like, okay, now I need to check.
So, sadly, as you can see, we could have talked for so much longer. We want to say a huge thank you to our wonderful guest. Really thank you.
You're welcome. Thank you so much for having me.
You are most welcome.
Great, thank you.
I hope we've all taken something from this, but I just want to end on the fact that knowing your biggest superpower is sleep. You can do anything once you've had a good night's sleep. So thank you, and I can't wait for you to join us very soon.